So good morning, everyone. We are uh, the group. We're the group 4, and today we're going to discuss the first unit, week 7, which is the cardiovascular problems, together with Gloriana Rainier, Medina Sebastian, um, yours truly, Pangilinan Ashley, and Taginogmel. For our outcomes, one, to discuss the pathophysiologic responses of clients with life-threatening conditions, acutely ill, high acuity, and emergency situation due to cardiovascular problems, analyze health status or competence of a critically ill adult client with cardiovascular problems, formulate a plan of care, institute appropriate corrective actions, apply safe and quality interventions, and offer client health education as appropriate. And we have to document nursing care and services rendered, ensure completeness, integrity, safety, accessibility, and security of information, adhere to protocols and confidentiality in safekeeping, and evaluate the client's health status. So first is, what is coronary artery disease, or CAD? It is the most common type of heart disease, and CAD happens when the arteries that supply blood to heart muscle become hardened and narrow or blocked. So sometimes this is called as atherosclerosis. So this is the CAD process. To summarize, so CAD happens when there is an inadequate blood supply. Tapos, dahil walang adequate blood supply, bababa yung oxygen natin sa heart, and then ischemia occurs. Then when ischemia occurs, blood supply to a portion of the heart muscle is cut off entirely dahil nga na-block na siya or wala na low oxygen na siya tapos nag-ischemia na. So wala na rin nagbibigay ng blood doon sa mga sa heart muscle. And then doon na nangyayari yung heart attack. So for diagnostic, take it away.
So for the procedure of in this diagnostic is cardiac catheterization. Catheterization. It is a common invasive procedure used to diagnose structural and functional diseases of the heart and great vessels under local anesthesia. Patient is awake so as to be easily assessed. The results guide treatment decisions, including the need for revascularization and other interventions to manage structural defects of valves or septum. It involves the percutaneous insertion of radiopaque catheters into the large vein or artery, right and left cardiac catheterization. Ginagamitan siya sa pamamagitan ng fluoroscopy. Isa din siyang diagnostic tool na parang X-ray din machine. Next. So meron tayong right cardiac and left cardiac catheterization. So sa right cardiac catheterization, ini-insert ito sa vein and usually precedes left heart catheterization. And next naman is left cardiac catheterization naman is ini-insert naman siya sa artery. At it involves the use of a contrast agent to visualize coronary arteries and ventricular functions. Next. So for these complications nitong diagnostic tool is dysrhythmia or abnormal heart sounds, venous spasm, an infection on the insertion site, and right heart perforation or parang may mga mini holes around sa muscles ng heart. And then next is the complications. Kidney and damage failure due to reduced
Slide 28 na pala. Bakit yun? Ingat siya kaagad. Purposes ka na.
So purposes nito is to do the coronary angiography or coronary angioplasty to assess the valvular function and or repair the valvular defects and to obtain the myocardial biopsy and to measure the pulmonary pressure. Dito natin malalaman kung may defect ba or may problem ba sa heart or kung may bara man or hindi. Next.
So next diagnostic is coronary angiography. So this may be done during left heart catheterization. And ito yung gumagamit tayo ng contrast na ini-inject natin sa blood vessel para makita natin yung may block na section sa veins or sa artery ng heart. So contrast agent is filmed as it passes through the coronary arteries. Thus, the vessels can be assessed for obstruction. Ayun yung sinasabi ko kanina. And the most definitive diagnostic test for coronary artery disease. So when we do the coronary angiography or kapag may procedure tayo na coronary angiography or sa patient natin, so ina-assess din natin sila kung may allergy sila sa shell, I guess, yung sa iodine because yung contrast na nilalagay dito is iodine siya. And next.
Next is for the angina pectoris. Angina pectoris is a clinical syndrome of pericardial discomfort or pressure due to transient myocardial ischemia without infarction. It is usually characterized by episode of sudden pain in anterior chest. For the causes, there is a continuous demand of oxygen that exceeds the ability of the coronary arteries to supply an adequate amount of oxygenated blood to the myocardium that facilitate the contractions and relaxation of our heart walls. For the clinical manifestation, we always remember that the patient with angina pectoris will always makakaramdam ng chest pain. Typically, the pain or discomfort is poorly localized and may accompany by feelings of tightness, strangling sensation, or a feeling of weakness, numbness, shortness of breath, pallor, diaphoresis, dizziness, and nausea and vomiting. To specify this disease, it has different types. First on the line, next slide, is the stable angina. Stable angina, whose commonly manifestation for having a heart disease, it is commonly caused by atherosclerosis or hardening of artery due to buildup of plaque. The pain is in pericardial or substernal chest area and precipitated by increased work demands of the heart. For example, physical exertion, eating large meal, exposure to cold, and emotional stress. Contrary to that, mostly the characteristic of pain that may we feel was constricting, squeezing, or suffocating sensation, usually steady, increasing in intensity, and only at the onset and end of attack. Radiate mostly on the left shoulder, arm, jaw, or other chest areas. The duration of the attack mostly occurs more than 15 minutes and relieved by rest, preferably sitting or standing with support. Contrary to that, there's an unstable angina, does not follow any pattern. It may be a new or occur more often and be more painful than stable angina. Unstable angina can occur with or without physical exertion. Rest medicine may not relieve the pain. Unstable angina is a medical emergency, but because it can progress to the heart attack. Next is for the vasospastic.
Seb, open cam ka.
Next slide, please. For the variant and vasospastic angina, it is called the variant or Prinzmetal angina. Cause is a spasm of the coronary arteries or temporary narrowing or tightening of the arteries caused by persistent contraction of the blood vessel, irreversible ST segment elevation. The spasm of the coronary arteries uh, can block the flow to the heart and cause serious pain. This type of angina usually happens while are you at rest between midnight and early morning and in a regular pattern of occurrence. For next slide. For the nocturnal angina, it is a type of unstable angina occurring at night during sleep. Next is the angina decubitus. This a proximal chest pain occurs when the client sits or stand up. For post-infarction angina is occurs after myocardial infarction when residual ischemia may cause episode of angina. For medical management, the objectives of medical management for angina are to decrease the oxygen demands of the myocardium like the nitroglycerin. Nitrates are the standard treatment for angina pectoris. It is a potent vasodilator that improves the blood flow to the heart muscles and relieve pains. This effect decreases myocardial oxygen requirements, bringing about a more favorable balance between supply and demand. Mostly ginagamit yung nitroglycerin, nilalagay siya sa ilalim ng dila or cheeks that ideally elevate the pain within 3 minutes once na nabigay na to. Pag may naramdaman pa rin yung patient na chest pain, pwede pa to hanggang 3 doses. Also, beta blockers, calcium channel blockers, antiplatelet and anticoagulant, and oxygen administration by nasal cannula, mostly 2 liters per minute. Thank you.
So next is for acute myocardial infarction. So it is most commonly known as heart attack, occurs when blood flows decrease or stops in one of coronary arteries of the heart, causing infarction or obstruction to the heart muscle. So for the zones, the zone of ischemia is myocardial infarction refers to the area of heart muscle that is not getting enough blood supply. Supplies, but is still alive. This tissue is under stress and may become damaged if blood flow isn't restored quickly. So T-wave can be seen in ECG. So second is the zone of hypoxic injury. Is myocardial infarction refers to the area of heart muscle that's suffering from a lack of oxygen due to reduced blood flow, which cause ST segment elevation. So for the zone of infarction and necrosis, is the area of heart muscle that has died due to a lack of blood supply also. Tissue is no longer viable and cannot be saved. It results from prolonged oxygen deprivation during an MI, leading to cell death. Next, please. So next is for the risk factor, which is the hypertension, vascular disease, hyperlipidemia, diabetes mellitus, male or family history of heart diseases, obesity and overweight, stress and lifestyle, physical inactivity, cigarette smoking, and alcohol beverage intake. Next. So for the cause, first is atherosclerosis or CAD. This is the most common cause, which is plaque buildup inside the arteries and reduces the blood flow. And clinical manifestations like severe unrelenting chest pain, cold diaphoretic skin or pale appearance, and nausea and vomiting. Next slide. So for diagnostics, ECG can be used to determine the coronary artery that is most likely affected by the ischemic event. So first is the ST segment elevation. It refers to a significant specific change seen on an ECG. It indicates that a portion of heart muscle is not receiving enough blood typically due to blockage in a coronary artery. Next is Q wave emergence, refers to the appearance of abnormal Q waves on ECG following a heart attack. And after that is the T wave inversion, or refers to a specific change seen on ECG where the T waves, which normally point upward, become inverted or point downward. This change indicates that there is stress or injury to the heart muscle, is often a sign of myocardial ischemia or necrosis. Then after that is persistent ST segment depression, which indicates ongoing myocardial ischemia or injury. Next slide. So next is treatment. So for oxygenation, it is maybe routinely administered to a patient as a part of primary care in the ambulance and emergency department because of decreased oxygen supply to the myocardium due to coronary artery occlusion. So for the pharmacologic, which is the morphine, it helps calm the patient, reducing stress on the heart and also relieves the chest pain. So for thrombolytics, restore blood flow by clearing the blockage, and it also minimizes the damage. Then for anticoagulants, are given during myocardial infarction or heart attack to help prevent new blood clots from forming and reduce the size of existing clots. For vasodilators, it helps relax and widen the blood vessels, and it reduces the blood pressure. So for the nursing management, rapid and focused physical assessment and history taking, vital signs monitoring, check and prevent bleeding, health teaching on risk reduction, and instruct the client to prevent performing Valsalva maneuver. Next.
So for heart failure, it is a condition in which the heart cannot pump blood effectively that will lead to insufficient blood flow to meet the body's needs. So it can cause symptoms like shortness of breath, fatigue, and swelling in the legs. Next po. So types of congestive heart failure, we have 4 types of congestive heart failure: left-sided heart failure, right-sided heart failure, systolic and diastolic heart failure. So sa left-sided heart failure, um, the left side of the heart cannot effectively pump blood, causing fluid to back up into our lungs. So this may result in shortness of breath, especially kapag physical activities or when lying down. The next is right-sided heart failure. So the right side of heart struggles to pump blood to the lungs, and it will lead to fluid buildup in the abdomen, legs, and feet. Kaya nga nagkakaroon tayo ng swelling sa legs natin. And then next is systolic heart failure. So this occurs when the left ventricle cannot contract vigorously, so it indicates a problem with the heart pumping ability. It often results in reduced ejection fraction and decreased blood flow sa body natin. So sa diastolic naman, so in this type of heart failure, yung left ventricle cannot relax or fill completely, indicating a problem with the heart's ability to fill with blood. So this often leads to elevated pressure sa heart and lungs natin, causing symptoms like yung similar siya sa left-sided heart failure. Next po. So for the risk factors, hypertension, so high blood pressure puts extra strain on the heart, leading to hypertrophy. So ito yung thickening sa heart muscle and making it harder para sa heart natin para mag-pump siya. And then over time, this can result sa heart failure. The next is diabetes mellitus. So this increases the risk of heart disease and can damage blood vessels and nerves that control the heart. So high blood sugars level can lead to coronary artery disease, so which is a significant contributor sa heart failure. The next is congenital heart defects. So structural abnormalities sa heart natin present siya sa or birth that can affect the heart's ability to pump blood efficiently. So this defect may lead to increased pressure and volume overload sa heart, contributing failure over time. So next is lifestyle sa cigarette or tobacco smoke and alcohol use. So smoking damages our blood vessels, increases blood pressure and reduces oxygen supplies to the heart. So excessive alcohol naman, consumption can weaken our heart muscle. So and may disrupt this function, both of which heighten the risk of heart failure. So number 5, obesity. So carrying excess weight, it may increase the workload sa heart natin and associated din to sa conditions like hypertension and diabetes. Next is valvular heart disease. So dysfunction of the heart dysfunction of the heart valves can lead to improper blood flow through the heart. So this can cause the heart to work hard to pump blood, leading to the heart enlargement and eventual heart failure then. Next po. So for the clinical manifestation, left-sided heart failure. So fluid builds up into the lungs, leading symptoms such as shortness of breath or dyspnea, so especially during exertion or while lying flat or nakahiga tayo. And then coughing or wheezing, often producing yung pink na sputum, yung pink protisputum ayun. And then sa right-sided heart failure, so systemic congestion siya, fluid